I'm Paul Vatistas. I'm a director at Haig Barrett Partners, and I work very closely on all our AI projects with clients.
And I'm Pascal Joncour. I'm a partner at Convergence Partners. I'm a venture capital investor and entrepreneur, and I've been in healthcare for over 20 years. And I'm delighted to attend the first Haig Talks here at the Savile Club, which will focus on AI and where we're headed to.
Businesses everywhere are having to integrate AI now into their strategies because it's going to have a big impact across all the functions of the business. So we see it in research, we see it in development, and things like drug discovery in the pharma world, but we also see it across the piece in areas like customer service, more and more in sales and marketing, and really all aspects of businesses. And I think the key message that I think to take away is that if your business is not thinking AI first, then you're going to find yourself in trouble over the next 3 to 5 years.
Yes, I would agree to that statement. AI is a big disruption in the marketplace, looking at healthcare, pharmaceuticals, and any stakeholder in the healthcare markets. I'm seeing like new business models emerging and obviously highly impacted by AI and the type of data that has been generated. And the data is now being collected in a totally different way and with like much more accurate data that also provides like an additional way to implement and deploy some new strategies that are currently not even possible based on what the AI was able to do. So the future is happening now, basically.
Yeah, and I think it's a good point you make about the data is really important. A lot of the data that companies have, they have reams of data and increasingly more and more all the time. But the data does need to be in a mode where it's clean enough to be used by these tools, or the tools themselves have to be designed to accept poor data. So that's a really good point, I think. Pascal, I think one of the things that we're really interested in is where do you think AI is going over the next 3 to 5 years, especially in and around healthcare?
So AI will fundamentally revolutionize healthcare in the sense that based on the data that is available, the constant monitoring 24/7, the accuracy of the analysis of the data. Just think about the imagery that is now augmented, looking at like large data sets of like thousands, tens of thousands of patients and being able to like increase the level of diagnosis. For instance, in looking at specific cancers, we have like large patient studies currently. And at the same time, it will start becoming your go-to life healthcare assistant, personalized, looking at your own data 24/7 with sensors on your body, in your body, around your home, looking at your, listening into your voice, looking at your face color, and just deriving some interesting like aspects of things that you may or may not be diagnosing moving forwards. Like I was just recently involved in a project where voice recognition, and I'm losing my voice here, so I would constantly be diagnosed into something, but voice has been now used to target diabetes 2 type of diagnosis through the voice recognition, and or some mental health, anxiety, depression type of conditions, just listening to your voice. That constant monitoring is a game changer. So you don't anymore go reactively to see your physician, but you're constantly monitored, and you will probably be nudged by your physician that you need to act and do something, change your sleep pattern, change your nutrition, change the way you are in the world. So it becomes like a healthcare fitness type of constant training. And those are just two aspects that I see really fundamentally changing our current approach to healthcare.
So I think the problem with trying to decide where AI is going to go over the next 3 to 5 years is that we don't really know. It's so hard to predict, I think, where it is going. It's moving so quickly. And even just today, there was an announcement from XAI, from Elon Musk's company, that he's built this Colossus data center in the US. And that itself is going to change the dynamic of where we might go in terms of what AI can do. So I think the problem with it, with trying to predict really beyond the next few months, is it's changing so quickly and so fast, and the behaviors of us and society and the way we work is going to change so quickly that the real prediction that we can make is the world's going to be very different in 3 to 5 years from today. And obviously we'll see a lot more AI agents around, more agentic behavior. But what exactly that looks like and how it affects all of us is very difficult to say at this point. The common challenges I think that all businesses are going to face, in addition to obviously the technology, is the whole issue about leadership, culture, and the skills of the people that they employ today. The number of people today that have good working knowledge of AI is very low, and yet that's going to be a core requirement, I think, in the future. And so I think the biggest challenge from my standpoint, and I talk a lot about AI first when I speak to people, but the biggest challenge is getting your leadership to really know where they're going and put in the kind of change and transformation programs that allow their people to move with AI. And I'm sure you see some of that in your business as well.
Yeah, no, absolutely. That leadership challenge exists in healthcare more than in any other industry, in the sense that historically, and we know healthcare is a conservative environment, and rightly so, because we would want to have like some safety and aspects of like proven results coming out of the therapies and the solutions we bring forward. At the same time, we face high, like always like more costly like procedures and environment and therapies, and the shortage of manpower. So there's less and less trained surgeons and physicians, and just thinking about psychiatrists, for instance, there's a huge shortage in the marketplace. And therefore, the adoption of new technologies, such as powered by AI, can provide like a massive like bridging into an environment that desperately needs more accuracy, more predictive ways to diagnose early, and to also deal with the conditions in a different way, discovering also new solutions and therapies for, say, like Alzheimer, which is like a massively impacting our societies. And that's where you see like drug discovery is impacted by AI. We have the FDA just recently for pulmonary disease actually approving an in silico designed drug, so totally de novo molecule that was invented by AI. And we see, on the other hand, more and more robotics, like also being implemented in surgery, being it in dental surgery or in heart surgery. We definitely see AI being, needs to be embraced. And also, just to bounce on the leadership challenge, think about the empathy of a machine that we currently see. You can repeat it and repeat and repeat and repeat, and the machine doesn't lose its temper. Different from a human being, maybe a physician that at some stage would act differently. So we see the power that also AI brings in interacting with a patient and bringing in surfacing some of their insights in repeated question in a totally different manner. So that's also where, surprisingly, the machine has a lot of empathy compared to a human being. So things to reflect, and I think those are typically leadership challenges that we need to take on for organizations if we think large hospitals, like large healthcare systems, etc. So that's.
And do you see that the as AI is implemented, do you see it replacing people? Do you see it replacing tasks? So going forward, are we dealing with AI agents as opposed to human beings, or is it some combination of the two, perhaps in with the physician or the clinician doing it a different way? How do you see that playing out?
I think it's a very ethical question. Personally, I would not want to get rid of the human factor in any healthcare interaction. And having said that, we see a lot of, let's say, robotic surgery performed by a robot that has done that surgery 10,000s of times, is learning every time from every new case, and that you can't compare it to any surgeon in the world anymore. And yet there is a surgeon obviously piloting this, but there's so much AI integrated in this that the surgeon is augmented in his own capabilities and abilities. So we're kind of looking at like almost like a meta-human type of surgeon who's like assisted by a robotic like being, like an artificial intelligence.
Yeah.
And so therefore, that, I think, to your earlier point, it moves into something that we haven't yet experienced. So how do we decide that we'd like to integrate this in our common view of this is how healthcare is performed, is the challenge of what we need to answer for the future.
Okay.